what you plan and what you anticipate this budget can accomplish in the coming year. And I remember I'm presiding, I'm not participating, but I make a comment that it would be interesting in the context of your presentation to hear whether or not you or future speakers think that the allocation of 44.7 million in the first instance for recurrent expenditure for youth and another 24 million for capital, whether you think that is adequate, a total of 69 million more or less. Is that in keeping, is that financing level in keeping with the ambition you have so eloquently presented? And I ask it not to get into the debate, but to try to allow us to have the data to make judgment and analysis. So it's just a comment on my part. I thank you again, and may I warmly welcome the Deputy Speaker of the Grenada House of Representatives, Dr. Clarice Modeste, who has joined the team to which she belongs as they now take the floor. I'm not sure which lights to recognize because there are two lights on, Senator Cox. I recognize Dr. Myanna Charles, Senator. You have the floor, Madam.
Thank you, Madam President. I rise today not out of ceremony, my dear friends, but out of duty. Duty to the healthcare workers exhausted and overworked in an underfunded system. Duty to the young woman full of potential but lacking opportunities. Duty to the families who are struggling to make ends meet due to the rising cost of living and with no hope in sight. Duty to our fellow brothers and sisters who, after being devastated by Hurricane Beryl, is still on their tarpaulins and tents 9 months later. Madam President, this is the lived realities of our people, well, except for a select few. I rise because this budget must reflect their needs and the needs of every fellow Grenadian who all long for tangible developments, and I hope we can all agree on that. Madam President, before I continue, allow me to extend a warm welcome to the persons in the gallery, especially our students, welcome, as well as those tuned in online. And I will start where the pain is most acute, healthcare. Because when a nation's healthcare system fails, everything else crumbles. The family suffers, the workforce suffers, productivity suffers. Therefore, it is imperative that health is a priority. In fact, I must first commend this administration, and I'd like you to give yourselves a round of applause. And I know some may wonder why. Well, I must give you credit where it is due. They have truly mastered the art of grand announcement with little to no follow-through. They have perfected the skill of making mediocrity look like an achievement. And of course, their talent for overspending on travel and entertainment for themselves while underspending in critical areas for the people of this country is nothing short of deception, Madam President. And to go further, Madam President, if those trips brought significant financial benefit to this country, then this would not have been a remark in my contributions here today. In the 2024 estimates of revenue and expenditure, under the caption Strategic Overview, health and wellness was listed as the first strategic priority area for this administration. Number one, I know my friend says she wants to hear 15, but you were listed as the number one strategic priority area for this administration. That is health and wellness. But Madam President, let's fast forward to the 2025 estimates of revenue and expenditure. Under the same caption, health and wellness has not been demoted to priority number 3. That, to me, is deeply troubling. And this is because in 2024, when health and wellness was listed as the #1 priority, we saw nothing happening in the Ministry of Health. Nothing, Madam President. And the evidence is blatant. So in 2025, when we see health and wellness demoted to #3, this is an indication that we are going from 0 to negative. And this is very concerning. So, Madam President, how can this administration claim to be one that truly cares for its people, when by their own admission, they told the nation that the needle hasn't moved in healthcare? This sends a chilling message to the nation and blatantly tells us that the numbers on this paper here today means nothing to this administration. I'm sorry to have to say this, but this is what it shows. Because the very commitments made in 2024 were just words, with no action to back it up, no follow-through. Nonetheless, I will still delve into the numbers, and in my contribution, I will round off the figures. Madam President, let us talk about the cold, hard facts, because the numbers don't lie. In 2024, this administration approved $122 million for health, and yet 24 million was left unspent. The year before that, 27 million was left unspent. So there is no excuse for not having had progress over the last 2 years. They had the money. It was approved in the budget, and yet not spent on critically needed services. That is 51 million total over 2 years. And I see all of them have their heads down. So I asked this administration, where is that money and why wasn't it spent? 51 million that could have been used to buy essential medication. 51 million that could have been used to repair or upgrade our health facilities. 51 million that could have been used to hire doctors and nurses so that our people don't have to wait hours in the emergency room or months for a surgery. Madam President, this 51 million is not just a number. It is a lost opportunity for our people. It pains me to say this now, and this makes me very emotional. But I wouldn't be surprised, Madam President, if some have lost their lives due to that. And now, we have yet another proposed budget for healthcare. And I cannot stop but wonder, what will be done differently this third time around? And it seems that this administration has a pattern, one that places optics over outcomes, one that underspends in critical areas and overspends on travel with nothing substantial to show for these trips. Yeah. Madam President, let's take a closer look at the 2025 budget allocations for health under Vote 50. This year, the total allocation for the health sector stands at 159 million, with 94 million allocated to recurrent expenditure and 64 million to capital expenditure. At first glance, one might say, well, the budget has increased. But let's break it down, because the picture is not as pretty as they want us to believe. Right. In 2024, the approved recurrent expenditure for health was 100 million, but only 88 million was spent, despite glaring and urgent need for better healthcare services. The 12 million that were left sitting there was not enough in the first place to resolve the severe shortages in medical resources and staffing. And now they come in 2025 and decrease the allocation for recurrent expenditure by 6.2 million, when compared to what was approved in 2024. Madam President, this does not even cover for the shortfall of the previous 2 years. So how is that improvement? Madam President, and for the benefit of the youths and everyone in the gallery, permit me to explain what recurrent expenditure is. Recurrent expenditure covers critical, non-negotiable, day-to-day expenses that keep our healthcare system running. It includes social benefits for those in need, salaries for doctors, nurses, and other healthcare workers, employee allowance, training and continuous education to improve healthcare delivery, maintenance of our hospitals, medical stations, and health centers, provision of essential medical supplies. Madam President, as I said earlier, the numbers don't lie. The budget tells us, yet again, that healthcare is not a priority for this administration, as evidenced by cutting the very budget that ensures our hospitals are staffed, our health centers have resources, and our people have access to the care they need. Tell us, who does this help? Is it that this administration no longer intends to provide medication for the poor? Is it that they no longer intend to make healthcare accessible to the most vulnerable? Is it that they no longer intend to correct the staff shortages? Madam President, I stand here right now, and I will list some additional facts. And I invite my colleagues on the other side to clarify or even verify some of them if they so desire. If someone comes in with a life-threatening condition, like a heart attack, for example, we're using that as an example, the hospital cannot confirm the diagnosis. Because a basic blood test, which is essential for confirmation, is simply not available. Let that sink in. Just a couple of weeks ago, I got a call from a friend, Madam President. She was frantic, she was desperate, because her loved one was in that exact situation. And do you know what broke my heart? Not just the fear in her voice, Madam President, but the cruel reality that in 2025, with an administration that claims to prioritize healthcare, we are still gambling with people's lives over something as basic as a blood test. Any given day, the lab is functioning at reduced capacity due to not having the test or reagents, or due to a broken machine. Basic tests are not available. Patients are forced, Madam President, to borrow money to pay for private labs out of pocket. And after all that, they must still pray that they have enough money left to buy medication they need because the hospital has run out. 2 out of the 5 dialysis chairs offering life-saving treatment to our citizens battling kidney disease are not functional and have been done for months. There are medical stations that are just open once per month because of staff shortages. A number of community health centers, or facilities I should say, because they include medical stations as well, cannot be reached because the landlines don't work. Let that sink in. Imagine you cannot reach a medical facility because the landline not working. How can we call this a functioning healthcare system? Nurses who want to advance training are left without opportunities. Yet, this government, in the other place, boasts about training a handful of staff. Yes, it is better than nothing. But let us be real. It is grossly inadequate. And let me remind this chamber, some of the achievements listed in the other place began under the previous administration, the new National Party. So I ask, what has this administration done for healthcare? Madam President, our doctors are being held hostage by bureaucracy and intimidation. Their morale is at an all-time low. I will echo a shared sentiment of many healthcare providers. They said to me, it feels like if the Ministry of Health is at war with us. The ministry employees are saying that the ministry is at war with them. How do you expect them to work without tools and supplies? They are not magicians. They are one of our most valued resources. Madam President, it is very painful to speak about what people experience as healthcare services. Let me give you the most recent example. As recent as a few hours ago, there was an emergency transfer last night from Princess Royal Hospital with a patient. The General Hospital was informed of the transfer. Madam President, the boat took an hour and 45 minutes to get down to St. George's. On arrival at around 12:20 a.m. this morning, there was no ambulance waiting to receive the patient. Mind you, this is an emergency transfer. Madam President, after several calls by the nurse who accompanied the patient, still no ambulance. Members of the Royal Grenadier Police Force at the Central Police Station, after recognizing for some time had passed and no ambulance, they came and inquired and also placed calls to the hospital to follow up on the patient transfer. Madam President, when water more than flour, someone, together with the police and the nurse, suggested using a private vehicle to transfer the patient. As they were about to do so, the ambulance was seen coming, arriving there at 1:10 a.m. Madam President, from 12:20 to 1:10, almost an hour waiting. And what was even more worse, the ambulance came with the driver alone. No nurse to receive the patient. The nurse from Carriacou has to now get into the ambulance and go to the hospital, which now further delay the departure of the chartered boat back to Carriacou. Madam President, these are the experiences of the people of Carriacou. It could have been any one of us on that boat. That is why it is so scary about the issues that confront this healthcare system. Madam President, this is the sad reality. Is this what we call a functioning healthcare system? Is this a transformation agenda? It has been 3 years with nothing to show for it. And while our hospital run out of medicine, while our lab shelves have no reagent to run vital tests, while equipment is down for prolonged periods, while our patient wait months for surgery because there is one anesthesiologist, while our healthcare workers cried for help, this administration had 51 million at their disposal over the last 2 years and did absolutely nothing. Madam President, this administration is talking about a new hospital. Let me be clear. A new hospital is an asset for any country. It is a great strategy to have for the long term. But what about the short term? Tell me. Let me also be clear when I say that a hospital is not just a building. If we are only thinking about the hospital as a building and not a healthcare system as a whole, then we are going nowhere. This trend of missing the know and thinking in a unidirectional manner, where patients are literally suffering before our eyes today, is a lack of planning and foresight that we see time and time again from this administration. If you do not ensure we have specialists to treat our people, medication to heal them, diagnostic tests to detect diseases early, and adequate insurance ensuring access for all, then all we are doing is building a monument. Our people do not want a monument. They need a functioning healthcare system. They need their lives to be saved. For this project to come to fruition, I asked my colleagues on the other side of this chamber to kindly indicate the source of funding for the completion of this new hospital. Not for phase 1, but for the completion of the new hospital, since we are talking about hundreds of millions. My colleague on the other side, the mover of the motion, in his contribution, said that they are thinking about it to the end. So clarify for me, where is the funds coming from for the completion of this project? Not for phase 1. Do you intend to take more loans and plunge this country into further debt? Tell me. That's the only time I heard a comment from my colleague on the other side, when I was stressing all the deficiencies, you know? So he agreed to borrowing more money and plunging the country into further debt. Madam President, I want to put on record in this honorable house that I see no problem with backing down for the concept of a new hospital at this time and strengthening what we already have at a fraction of that cost and with instant benefits for our people. Madam President, I want to draw your attention to some disturbing numbers as it relates to our healthcare facilities. Line item, upgrade of health facilities. 1 million budgeted for health facility upgrade in 2025. We must not forget, in 2024, 1 million was approved for health facility upgrade. Only 175,000 was spent. Is the million for all the health facilities, or is it for a specific facility? Is this administration aware that we have 30 medical stations, 6 health centers, the General Hospital, Princess Alice Hospital, Princess Royal Hospital? Because if it is for all the facilities, then it is clearly not enough. And yet we are still not spending it. Line item, refurbishment of buildings. 300,000 is budgeted for the refurbishment of buildings. In 2024, 700,000 was approved. Only 478,000 spent. Which buildings? Can this administration give this honorable house a breakdown of the buildings that were refurbished in 2024. Line item repair to Carlton House. In 2024, $500,000 was approved to re-establish Carlton House, a facility for persons suffering with substance abuse. $0 spent. Are you abandoning Carlton House and the right against substance abuse? Or is the $1 million budgeted in 2025 for the Maribor Rehabilitation Center intended to replace Carlton House? Please provide some clarity regarding this and give some details on the services that will be provided with a Maribor Rehabilitation Center and a timeline for completing this project. Line item, smart upgrade to hospital infrastructure. In 2025, $100,000 is budgeted for smart upgrade. Let's not forget, in 2024, $400,000 was approved, $0 spent. What happened there? Where has this money gone? Was it reallocated? Line item, reconstruction of Guelph Health Center. In 2025, $700,000 is budgeted for the reconstruction of Guelph Health Center and to restore the former building that was temporarily used during the health center construction. Last year, $700,000 was approved for this, Madam President, $0 spent. Madam President, I must raise a serious concern about the $700,000 allocated for the reconstruction of the Guelph Health Center. This is a new building. It is not an old, crumbling structure needing reconstruction. In fact, it was built less than 5 years ago. So if you intend to restore defects, then say so. Why name that line item reconstruction? Be transparent. Madam President, we need transparency. This government must explain how they are spending the people's money. Also, why is the Guelph Health Center not operating in its full capacity? It is my understanding that equipment that has been donated have gone missing. Where is the missing equipment? Line item, health centers and medical stations maintenance project. Madam President, while our health centers crumble, this government allocated a mere $150,000 in 2024 for health center and medical station maintenance. Out of that, only $48,000 was spent. Now in 2025, the same $150,000 is budgeted for maintenance. Let's break this down. As I mentioned before, we have 30 medical stations, 6 health centers. This means $150,000 divided by 36 facilities. This equates to $300 per month per facility. Madam President, $300 per month is supposed to maintain an entire health facility? What can $300 per month do in today's economy? Probably buy a can of paint. I don't know. Because I know painting is a thing for some. Now, this has to be a gross miscalculation. But let's entertain another possibility. Maybe, just maybe, there is another allocation hidden somewhere else in this budget for the exact same thing. And if that's the case, then why is this administration double dipping? Madam President, this is not a serious investment in healthcare infrastructure, and this 2025 allocation clearly shows us that. And I'm going to now move to chronic diseases. Madam President, let us talk about chronic diseases. Line item, National Non-Communicable Disease Control Program, which is supposed to tackle the main cause of death and disability in this country. The 2025 budget allocates a mere $125,000 for this. To put this into perspective for everybody here today, or as my good friend on the other side will say, context. Non-communicable diseases are chronic diseases and include conditions like diabetes, high blood pressure, high cholesterol, heart disease, cancer, asthma, and the list goes on and on. Based on health data from World Diabetes Federation in 2021, 1 in 7 adults, that is 10,000 adults in Grenada, has diabetes, and these numbers have since increased. Based on that data for diabetes alone, mind you, I listed a few chronic diseases, not even all. If we estimate that at least 60,000 people at some point in the year need chronic disease management, this allocation translates to a shameful $2 per person for the year. Shameful. $2? $2 $2 per citizen for the year? Can you think of anything that costs $2 a year? A year? And while this administration offers $2 per citizen per year, they have somehow found over $18 million for the so-called beautification and transformation program, overspending by $6 million. I will leave that for you to ponder on. So let me ask, am I missing something? Is there another allocation tucked away somewhere in this budget, specifically for chronic disease management? If so, I stand corrected. And I invite this administration to point me to that line item, because I would love some clarity. And if not, then let's call this what it is: misplaced priorities, lack of vision. Or I wonder if this is what transformation is all about. Madam President, if this administration is even remotely serious about health and wellness, they must increase this allocation. Because chronic diseases are not just numbers on a page. They are the reason people are in our hospitals, in our clinics, and struggling to survive every day. And if this administration does not see this as a priority, then perhaps my friends on the other side can explain how this budget treats healthcare on a whole as a priority. Medication. Madam President, I'm not sure if you're aware about the OECS PPS pooled procurement system, but I think it's my duty to explain to everyone. This is an arrangement where OECS countries collectively purchase medication and medical supplies in bulk to secure lower prices and ensure adequate distribution across member states. It is intended to be a cost-effective way to keep essential medication available and available to all. I think that it is necessary to explain this so you can understand, according to my friend, the context in which I am addressing this line item. I would like to draw your attention to page 851 for this line item. In 2024, this administration approved a mere $12,500 for this program, and not a single dollar was spent according to the budget. These are the figures presented to us, unless this budget have numerous errors, I don't know. Now, in 2025, the budget has an allocation of $112,500. Let's put that into perspective, or my friend will say context is key. So let me give you some context. In 2024, this administration allocated the equivalent of 1 cent per Grenadian for essential medication and supplies. Now in 2025, they have increased this to just $1 per Grenadian. Context is key. So here is the context. Madam President, this is not only an insult, but I do believe that you all will agree that this is far from addressing the pertinent problems in healthcare. How does this government expect to adequately stock our hospitals, health centers, and pharmacies with life-saving medication with just $1 per citizen? Really? This underfunding explains the empty medicine shelves in our hospitals and dispensaries, the increased burden on the healthcare system as untreated conditions escalate into emergencies, the overcrowding and casualty as preventable diseases go unmanaged due to medication shortages. If this administration had properly allocated funds and utilized the OECS PPS program, our hospitals would not be facing medication and medical supply shortages to the degree and length at which it exists today. And that is a fact. And this is an obvious failure, Madam President, of identification of what are the priorities in healthcare. They cannot even identify it. So how can you remedy it? Madam President, let us now turn to the handling of grants. Grants are not loans. Am I correct? Are they loans? They are given to governments to support critical programs that directly impact the people. And they do not have to be repaid. Am I correct? Correct. All right. I draw your attention to page 850, capital expenditure by source of fund. In 2024, this administration approved $2.1 million in grants, but only $500,000 was spent. This raises critical questions. Did this administration send back the $1.5 million to the grantor because they failed to spend it on critical healthcare initiatives? Or is it that they failed to secure the said grants they budgeted for? I would like to have some clarity in this regard. Madam President, this is unacceptable and indefensible. While our hospitals run out of essential supplies, this administration failed to use $1.5 million in grant funding. While patients are being turned away because of lack of mattresses on beds in some of our wards, $1.5 million was left unspent in grant funding. How hard is it to use money that you don't have to pay back in areas where it is needed? Madam President, I would like to hear from this administration the steps that will be taken to prevent this from happening again in 2025. In democratic countries, governments are held accountable, no? Last time I checked, we are a democracy, but sadly, the lack of accountability will continue to lead us further south. Madam President, while essential areas on healthcare continue to suffer, this budget includes vague and questionable allocations that raise serious concerns about transparency and accountability. We see $1.5 million allocated for focused succession planning, yet there is no clear explanation of what this entails. Similarly, $300,000 has been earmarked for capacity building campaign. But is this money being spent on actual workforce development? Madam President, we need mattresses in our hospitals. We need reagents in the labs. We need medication on our shelves. We need landlines to be working. We need doctors and nurses to be taken care of. We need staff shortages to be bridged. We need the backlog of surgeries to be taken care of. We need those things today. In fact, we needed it yesterday. Speaking as a medical doctor and public health specialist, this healthcare budget needs to be revisited and restructured in view of all the things mentioned earlier, so that it can be impactful on the ground, failing which we will be sitting here in this very chamber, hopefully in 7 to 8 months from today, repeating the same outcry. Mark my words. Madam President, this is not an exhaustive list I have mentioned. There are much more issues that need addressing, but in the interest of the time allocated for my contribution, I am compelled to move on to the next topic. Youth and sports, vote 19. Madam President, you know what resonates at this time in Grenada? It is the reality that talent is everywhere, but opportunity is not. That is what resonates. What context is key. Across our tri-island states, young people brim with potential in the classrooms, on the fields, in the workplaces, in this very house. Look at all the students we have here today, in their communities. Yet, this budget does not meet them with the opportunities that they deserve. In fact, I see a harsh blow being served. Before I go any further, I would like to address my fellow young woman on the other side of the aisle. My colleague on the other side said, in a lot of words, that youth is an area that is over-budgeted. Her words, not mine, over-budgeted, to make an excuse for the harsh blow we see in the 2025 budget. But, Madam President, we on this side deal with numbers, and in 2025 budget, on the vote 40, we saw over 12 million in overspending in the division of youth. So if according to my friend on the other side, this is an area that is over-budgeted, how do you expend the overspending? Tell me. I really want to know. You know what this Keisha distributed is for? It is to lock the door on the facts. So, Madam President, permit me through you to return this key. Where is it? On the other side. Because we here will not hide the facts. So permit me to return it, please.
I agree.
Which is that we see a 40% cut in the division of youth from what they spend in 2024. And we see a 30% slash in the division of sports. Madam President, what message does this send to the young people of this nation? To the students in the gallery here today? Where is the government's commitment to youth empowerment, skills training, and job creation? Job creation. How does this administration stand there and try to justify gutting the very programs, like the Imani and my friend had a monologue on it, and others that serve as stepping stones for our youth to build a future? Please, do show this honorable house how is that contributing to the long-promised transformation beyond lip service? And I understand they no longer talk about the transformation. Madam President, my colleagues on the other side seems to be assessing and reading what the previous administration has done for the last 3 years, rather than acting. I am sure she may be needing the lenses soon that she walked in here with today. Let me say this, and I will quote from the member on the other side, because what she's reporting is not new. Context is key. If you haven't taken no new applicants into the program, how would you see an increase in the numbers? Tell me.
Charles, I believe, please pause. Senator Sybil has requested the floor. What is it, madam? Point of order? Microphone, please.
Madam President, I stand on a point of clarity.
Proceed.
Through you, Madam President, I would like the honorable member, Senator Charles, to please provide proof to this honorable House at which point during my speech I mentioned, and she said, the honorable member said, and I quote, that the budget for the Ministry of Youth or for the youth of Grenada is over budgeted. If that cannot be provided, Madam President, I would like for the honorable member to please retract the statement and stop misleading this honorable House.
Thank you. Senator.
Madam President, this is not a point of clarification, and I will not yield. I will continue with my debate, if you so permit me.
What did you say about the point of clarification requested?
I said, this is not a point of clarification, and if you would permit me, I will not yield. I will continue with my contribution. In the interest of time, I have 20 minutes left, and I still have a lot more to say.
It's a point of information. Are you saying you stand by your statement?
Yes, Madam President.
Proceed.
Thank you. And let us be clear, when it comes to sports, it is not just mere games. Sports is an ethic. Sports is a culture. It is a catalyst for change, a force for national pride, and a vehicle for economic mobility. When we cut sports funding, we don't just take away a ball or a field. We take away scholarships, international exposure, and professional coaching. Access to sports is not limited to youths, Madam President. It is for everyone in different age groups. It positively impacts our health. So when we cut budget in those areas, we are directly impacting health. Does this government not realize that sports is also a powerful tool in crime prevention, community engagement, and national development? Does it not recognize that every dollar invested in sports is a dollar invested in keeping young men and women healthy and away from the dangers of crime, drugs, and violence? Madam President, allow me to be frank. This is a policy failure, another missed opportunity, and a betrayal of our young people's future. This administration is one of rebranding, not innovation. If this administration was serious about youth development, it would invest, not divest, in their future. But instead of innovation, all we see in this budget is rebranding of old programs, repackaging with new names, but with the same NMP foundation. Let's talk specifics. The Empower program, started by the New National Party, designed to provide young men ages 18 to 35 with self-empowerment, holistic development, skills certification, and employment opportunities. In 2025, 3.5 million has been allocated. But in 2024, the approved allocation was 2.5 million, and only 1.1 million was spent. Only 1.1 million was spent. You can look at them, or should I repeat these numbers? Madam President, where is the accountability to our youths? I challenge this government to provide answers. How many participants enrolled in the Empower program in 2024? How many completed the program? How many secured employment and started businesses after completing the said program? You cannot claim to champion youth while underspending on youth programs and then turning around and cutting funding. Let us not forget, this is a nation where youth unemployment remains high. The medium-term fiscal framework report exposes this truth. And it goes further to tell us that our young women face higher unemployment rates, 15.8% compared to 7.2% for men. The highest levels of unemployment existed among those up to age 24. Yet, where in this budget is the bold, decisive action to address this? Where is the structured investment in skills training and innovation to equip young people for today's economy? Madam President, our young people do not want handouts. They want opportunities. And they need to be truly empowered. They want to work. They want to build. They want to contribute. But what they have been given instead is a budget that shrinks their prospects, slashes their opportunities, and stifles their future. The youth of this nation are watching. Madam President, I wonder how they will respond while hearing this discussion. They will remind us very soon of this very discussion. Yes, they will remind us very soon. I urge this administration to reconsider.
Thank you, Madam President. Yes, I have requested the floor because, Madam President, sorry, I'm standing on a point of order. And the rules of the House indicates clearly that we are not to mislead the members in this honorable House. And Madam President, as requested in my first rising, I asked that the statement be retracted because such statement was never uttered during my presentation. Therefore, I would like for us to review the Hansard so that this can be clarified, because I do not wish for the young people of this nation to have the misrepresentation and the misconception that their representative is saying that the reduction in the budget is, in fact, a good thing.
Thank you, Senator Civil. The request for the Hansard reporters take note. And, of course, you can exercise your right of reply later on following the presentation of Senator Charles. I'm not sure actually about that because you can only speak once in the budget presentation. So at the time of adjournment, you can come back to it. But I hear your request, and that it will be so reflected in the Hansard report that you did not say what you said, what is said you said. Is that it, what you're saying? 1 second, everyone. Let me take some information from the Deputy President of the Senate. Go ahead, sir.
Thank you very much, Madam President. Madam President, it's within the right of any member to request a copy of the Hansard for clarity on any matter, any utterances in the House. And so whenever that particular statement or comment can be verified, because I believe both members feeling correct in their responses and their position as such, Madam President. So when you have that answered, you will give a determination as to what was said or what was not said, and whether or not comments could be struck off or maintained as is. So that's basically it. It just the only issue, Madam President, I don't know if the copy will be available at the time of closing, but you can always deal with it at a later date. So, thank you.
Thank you, Senator Cox, Leader of Government Business.
Thank you very much, Madam President. Madam President, I believe that each one of us here has been listening to both senators in regards to what was uttered. And I think it is up to you, Madam President, to rule on the matter at this point in time as to when that will be determined. If it can be determined now before the senator proceed, I think it will be in the best interest of this House and the general public. So I leave it up to you, Madam President.
Thank you. For some guidance here, we are speaking on the Article 35 of the Standing Orders, Article 35, interruptions on a point of order. Now, if Senator, for so swiftly producing the written record, thank you all. I also omitted earlier on to welcome the school children to our debate on the estimates. You're very welcome. And I also want to welcome the Leader of the Opposition in the House, MP Emmeline Pierre, who is also with us. Thank you very much. Senator Charles, you have the floor, Madam.
Thank you, Madam President, and thank you for your consultation. I would like to state that it is my interpretation that my colleague on the other side said in all other words that youth is an area that is over-budgeted to make an excuse for the harsh blow we see in the 2025 budget. Madam President, the facts are there. We saw a 40% cut in the Division of Youth, a 30% slash to the Division of Sports. The youth of this nation are watching, Madam President. I wonder how they will respond right here in this discussion. They will remind us very soon of this discussion. And I urge this administration to reconsider, to reallocate, and to reprioritize. Because when you cut youth funding, you do not just cut programs. You cut futures, you cut dreams, and you cut the very foundation of this country's tomorrow. Madam President,
Pausing Senator Charles. Senator Francis, you have the floor.
Thank you, Madam President. I am not standing to disrupt the honorable member for disruption's sake. But, Madam President, on a point of order, we just had a consultation where the agreement was for the statement to be retracted before proceeding. The statement, a new statement was made, but no retraction of the old statement.
Thank you, Senator Francis.
Thank you, Madam President.
Senator Charles. I think this is what we agreed to.
Thank you, Madam President. It was my understanding that we agreed to clarify the statement and to state my interpretation of the statement. That was my understanding. And this is what we agreed on.
Based on the retractment.
Madam President, it is my understanding that we agreed to reformulate, not retract. This is what was discussed. That we agreed to reformulate. In fact, the other side of the House heard the reformulation before I came back in here, and they agreed. But we agreed to reformulate. This is what we agreed to do, reformulate.
Senator Francis.
Yes, Madam President.
You were speaking. I want to hear your response to the manner in which Senator Charles has
Madam President, from the very first time I stood, I asked that the statement be retracted. The fact that we went into a private session to discuss and to consult, I would not agree for anything less. Therefore, Madam President, in the midst of the other person who were in the consultation, the agreement was yes, the statement be reformulated to reflect her interpretation, which is fine. However, the statement previously made that is being reformulated must be retracted in order for the new statement to take precedence and to have the meaning that it so deserves. And that is only fair, Madam President. Because then we have two statements on the floor. And the statement before, once it's not retracted, reflects that Senator Civil Francis said that there's the Ministry of Youth budget is over budgeted for young people. And I do not wish for these sentiments to be in the airs or recorded for young people to think that this administration don't care about them.
Thank you, Senator Francis. Senator Charles. Before you speak, please approach the chair, the presidency. Senator Charles.
Madam President, thank you for your guidance on this matter. This reformulation, I am going to state, retracts what was said earlier. And this reformulation reads, I would like to clarify that it is my interpretation that my colleague on the other side said in a lot of words that youth is an area that is over-budgeted, to make an excuse for the harsh blow we see in the 2025 budget. Madam President, the facts are there. We saw a 40% cut in the Division of Youth, a 30% slash to the Division of Sports. So this is the third time I'm stating the reality, the cuts we saw in the Division of Youth and Sports. The youths of this nation, I will say it again, Madam President, they are watching. They are watching. And they will remind us very soon of this very discussion. And again, I would like to encourage this administration, or rather urge, to reconsider, to reallocate, and to reprioritize. Because when you cut youth funding, you do not just cut programs, you cut futures, you cut dreams, and you cut the very foundation of our country's tomorrow. Madam President, if you allow me, I'll proceed, and I do hope I get back the time, to housing. Madam President, every ministry, every department should be looked deep into. The problem should be extracted, and the solution should combine genuine consultations on the ground in order to yield the best outcome for our beloved country. So as it relates to housing, when I first heard this administration talking about tackling the housing deficit, I applauded the principle. After all, every Grenadian deserves a safe, affordable place to call home. But principle without performance is what? is just propaganda. Initially, it was 500 homes per parish. Then the target was 500 Grenadian-style homes per year, which means by now, we should have more than 1,000 by now. But Madam President, let us cut through the rhetoric and look at the reality. Millions were allocated. Plans were laid. How many happy homeowners did we get from this program today? Please advise us. And now, 3 years later, the vision has shrunk. But what do we have to show for it? Madam President, under Vote 33, in 2024, 9 million was approved and 9 million was claimed to be spent. This year, another 10 million is allocated. And how many happy homeowners do we have to show for it? How many? This government speaks of the Emergency Housing Recovery Plan under the Build Back Better project. But let me ask, Madam President, how do we define emergency? What is an emergency? Is it a story I told earlier about a patient that was transferred from Carriacou? Because 9 months after Hurricane Beryl struck, families in Carriacou and Petit-Martinique, where 98% of the houses were destroyed, are still sleeping in tents, still covering their roofs with tarpaulins, still waiting for relief that was promised months ago. And while we sit in this chamber and debate, while people are suffering, my colleague Senator Cox told us in this honorable chamber on Tuesday about the reality in Carriacou and Petit-Martinique, and I was very saddened by it. Just last week, visitors to Carriacou left with their hearts shrinking and sinking because the gap between the government promises and the reality is horrific, it is wide. Madam President, 147 houses at various stages. What does that even mean? We heard that in the other place. 147 houses at various stages of construction. Madam President, what does that mean? We want to know how many have been completed, how many have been handed over, and when will the next 100 plus be handed over? That is what the people want to know. Madam President, this is what you call broken promises. And then, Madam President, we heard about, they're going to address the housing shortage, and they don't make idle promises. Well, what do you call this? We understand that there are challenges, and one of the challenges we heard in this house was shortage of skilled workers. So let me ask, how did you not anticipate this? What is your plan to remedy it? How does a government commit to building all these homes in the first instance without ensuring the workforce to build them? Where are the people to build them? Wasn't that something that needed to be addressed before making such a promise? And Madam President, this one I promised myself I wasn't going to go there. But let us talk about the Chinese-built apartments donated by the government and people of China for low-income families. What happened with that? What happened? Instead of ensuring that low-income Grenadians got these homes, it is my understanding that the majority of units were sold, yet they remain unoccupied. Can you imagine that? People buying houses and they're not even staying in it? So I asked, who were they sold to? Were they sold to Grenadians? And if not, why not? Madam President, the people of this country deserve reliable answers through this budget. I will repeat, they need answers through the budget. This administration must make deliverable promises. Grenadians are tired of beautiful words. They are losing hope, Madam President. They are losing faith daily. We don't need fancy press releases and lofty speeches. We need houses for our people most affected by Hurricane Beryl. I call on this administration to move on and to move from excuses to execution. Please, I beg. Move from excuses to executions. Move from broken promises to proper planning. Madam President, the people are watching, and they will not forget this. And, just to go back, were the houses, I know my friend said, yes, they were sold to Grenadians. Were they sold to Grenadians living here? I would like to know if you have a breakdown local, what they sold to Grenadians living here. I would like to just know that. Madam President, we see an increase in the budgetary allowance here in terms of social development, but we also see a lot of overspending in that area. But the reality on the ground paints a different picture. The seed program. We were told that there are 7,600 beneficiaries, but under Vote 35, only 50,000 allocated, and yet they are still handpicking who gets the benefits. Where is the compassion and empathy in caring for our elderly and vulnerable citizens? I want some clarity on some line items where there is overspending. One area is community self-help program. What is that? Because 6 million was allocated in 2024 and 8 million was spent. And now another 6 million is allocated. I seek detailed clarity on the breakdown of this expenditure. Not just a line, a statement. Detailed clarity on a proper breakdown. While we see overspending in ambiguous areas, we are seeing underspending in critical areas. Line item Hurricane Beryl response, 14.5 million allocated and only 4.9 million spent. This is just heartbreaking. Make it make sense. Make it make sense. Madam President, this is the reality. And this reality is not up for debate. It is what it is. In closing, I want to remind this chamber, on Tuesday, it was my interpretation that I heard that this administration is deeply committed to putting the people first and deeply committed to enhancing healthcare. So if this statement is true, I expect to see a thorough review and reallocation of the healthcare and other budget items in a manner that practically addresses the reality on the ground and the critical needs of our people. Those are real. The needs of our people are real. We on this side of this chamber, we are not merely critics, Madam President. We are not merely critics. We are here to do a job. We are here for the people of this country. And we stand ready to work collaboratively if the government is serious about delivering impactful results. So allow me to outline a series of concrete, actionable steps that must be done. Fully spend the allocated funds with accountability. Not at the end of the year, but monitored quarterly. Stock up the shelves in our labs and pharmacies. Budget for the appointment of critically needed human resources in the healthcare sector. Immediately attend to the maintenance of broken equipment. Freeze the beautiful concept of having a new hospital for now and prioritize the saving of our broken healthcare system and services. Save it. Put primary healthcare as a priority through reallocation. Expedite the rollout of national health insurance with a clear and realistic timeline. Address the ballooning prices of essential healthcare items. Consider targeted VAT exemptions for essential medicines and medical supplies. As for youth and sports, the whole budget needs to be reviewed, in my humble view, to reflect the needs and aspirations of our younger population. As for housing, let us move into realistic deliverables that will respond to the housing shortages throughout the country. Give us 100 solid houses every year, and I assure you that everyone will be grateful. Address the labor force shortage, perhaps with incentives. Support the contracting community with initiatives that will enhance their outputs, both quantitatively and qualitatively. Those are striking force for any successful housing program. Get the diaspora involved in innovative housing and creative housing schemes. Madam President, our pains are many. Our pains are many. And I'm merely touching the surface of what needs to be done. We are now at a juncture where the government has exhausted its grace period. Yes, they have exhausted the grace period. We have seen 3 years go by with nothing significant to show for it. We have 9 months left in this budget year, with the government trumpeting large sums yet again. Meanwhile, the people are losing faith. The clock is ticking, and lives are at stake. Hence, I end with my plea to this administration, a plea on behalf of every Grenadian. Come back to us at the end of the year with achievements that matter most. There is no problem in phasing, in reallocation, in increasing budgets. But in my humble opinion, this budget in its current form is a recipe for non-delivery. Let us do it in unity. Thank you, Madam President. Thank you.
I thank you, Senator Charles. Thank you. Thank you very much.